Great. Thank you. All right, Jennifer, you've been waiting patiently. So, um, what is so with chronic kidney disease, how does salt intake affect its progression? And I apologize, these questions again, because of your different expertise, are going to be a little jumping from thing to thing. But so what are your recommendations on salt, and does salt type matter? And we had our last speaker was talking about celery salt, like salts, I guess, being processed through plants are
Mm.
somehow different than the salt that we would get in the store, regardless of what kind of salt that is.
Yeah. Well, salt is one of the first things that I speak with patients about, salt and protein, keeping protein down and salt down. But salt definitely will raise blood pressure. And also, salt is linked to kidney damage directly. So it increases proteinuria. So even without raising the blood pressure, it still can cause damage. Um, and then, I always say that I tell my patients, if you're a kidney patient, you're a heart patient, because more than 50% of kidney patients die actually of some sort of cardiovascular issue. And um, so with salt, then you've got two guidelines. You've got the KDOQI guidelines, which say 2,300 milligrams a day or less. And then you've got the American Heart Association guidelines, which are 1,500 milligrams a day or less. I tend to go with the American Heart Association guidelines because, like I said, kidney patients are heart patients. Now with that, most of the time, most of the people that I work with, they're not dealing with celery salt. They're dealing with, fast food and salt in their food at the table. They may come out with like, well, I do this. What about this Himalayan pink salt or whatever? It's still salt. It's still going to raise blood pressure. It's still going to damage the kidneys, especially if your kidneys are already damaged. What you're trying to do is let the kidneys rest. You don't want to drive them further. So the less work that the kidneys have to do, the better. And so I tell them to limit salt. And with that, we talk about looking across the entire day. Don't be so focused on every teeny tiny little thing. Look at your day and make sure you're staying within those guidelines. And you know what? And they can do it, but you've got to have other options too. You've got to help them learn how to season their food. And so another thing with kidney disease is inflammation. Well, um, dried spices have such high antioxidant values that they'll help lower inflammation. So let's kill two birds with one stone. Let's bring down the salt intake, bring up the spice intake, lower inflammation, lower blood pressure, lower proteinuria coming through those kidneys. And yeah, and stay out of that dialysis chair.
So, first of all, what is proteinuria? Can you define that for the audience?
Yeah, so proteinuria. So clinical proteinuria is when you're spilling so you've got protein in different areas. You've got protein in food, you've got protein on your body, you've got protein in your blood, but you should not have protein in your urine. So, but a lot of times if you're a diabetic or have high blood pressure and you're not getting your urine checked yearly, I highly, highly recommend that you do that because when someone's kidneys are damaged, they begin to spill protein in the urine. That's called proteinuria. One way that you can know that is if you have kidney disease and you're looking at your urine and it's very bubbly, that is an indicator that you may have protein in your urine. If you're a diabetic, same thing. But a lot of times the problem, and this hasn't gotten better over the years, is that when I was in the dialysis centers, most of my patients came to me because they were in ER crash, and by that I mean they had no idea they had high blood pressure. They had no idea, or they did know that they were diabetic or had high blood pressure, but they didn't know they had kidney damage because their urine wasn't getting screened every year. So make sure your doctor screens your urine. But then they crash into the ER. They show up, they're throwing up, they've got swollen legs, and the doctor says, I'm sorry, your kidneys have failed, and we've got to put a shunt in your neck right now because you have to go on dialysis right this very minute. And that is a very, the risk of death with that shunt in the neck is so much higher, 50% greater chance of dying within the first 90 days of dialysis. And it's just not a way to start. You don't want to start in the first place, but if you are going to start, you want a controlled start. And so, anyway, that is why you need to have your protein checked. And no protein in the urine is normal, first of all. But if you're spilling greater than 3 grams, it's a pretty big deal. So you want to get that down. And here's a way to explain it. So, and this a nephrologist told me this one time, and I thought it was pretty interesting that if you have a colander and you're washing your grapes, the little holes in the colander are so small that those grapes won't come through. But if your dog chewed that colander and those holes got bigger, the grapes are coming through now, and that's not normal. So in your kidneys, you have a glomerulus, and the holes should be small enough that the protein doesn't come through. But when you damage it with high blood pressure, diabetes, genetic conditions, things like that, those holes become bigger, and then the protein comes through, and that is not normal. It's not something that you want to have, and so that's what it is.
And so you mentioned limiting protein. Is that dealing with a symptom when you need to require someone to limit the protein, or is protein actually causing kidney issues and we're eating too much protein in our diet?
Well, we are eating too much protein in our diet. Most of the time, I mean, that's not what's causing the initial kidney damage. It's usually like the main two causes are diabetes and hypertension. And then you can back up from there. Obesity is usually causing the diabetes and the hypertension. And then you've got genetic conditions like IgA nephropathy or polycystic kidney disease, lupus nephritis, things like that. There's a whole slew of genetic conditions that cause kidney damage. And so with the pre-ESRD space in a pre-dialysis patient and a dialysis patient are very different. So do not go out on the internet and start looking for diet information because it's going to be for dialysis patients. They need high protein. They lose protein every time they sit down in that machine to get their blood clean. A pre-dialysis patient needs low protein. And the more protein you eat, if your kidneys are damaged, if you've got that damage on the glomerulus, you're going to drive more protein into the urine. So it's the opposite because a lot of times when you begin to urinate out protein, certain blood protein indicators will start to go low. Well, that's really more inflammation. And when you eat more protein, you're going to just lose more protein, especially animal protein. So plant protein is safer, but when you're eating a lot of animal protein, you're going to have more proteinuria. And the other thing is, when people are eating a lot of animal protein, they become more toxic. And so then they get like a metallic taste in their mouth and they don't want to eat. So then they have a spontaneous reduction of food intake anyway, and then they become malnourished. So what I would say is work with a dietitian, get on plant-based proteins, lower that inflammation. If you're there's different stages of kidney disease. So if you're stage like 1, 2, 3, then you can pretty much just do a plant-based diet. Don't chase protein. Don't go be doing a bunch of protein powders and running after tofu all the time. Just do a plant-based, whole food plant-based diet, and you pretty well will be okay. If you start to get stage 4 or 5, then you need to go to a very low protein diet, and then you supplement back with something called keto analogs of amino acids that keep you from being protein malnourished, but also will help scavenge some of that protein from your diet and from endogenous protein breakdown. Um, and then that way, again, your kidneys have to deal with less protein. Protein is the only micronutrient with nitrogen in it. Your kidneys have to filter nitrogen waste. So if you're a kidney patient, you may have seen something in your lab like blood, urea, nitrogen. That's what they're looking at. They're looking at that waste that your kidneys are not getting rid of. And so that's why we limit protein. One of the many reasons why we limit protein.
Yeah, people are so worried about protein and getting enough. And if anything, I'm more worried about getting too much.
Right.
I'm not even talking about kidney patients. I think in general, people are just trying to get way too much protein. They wind up hurting themselves in that effort to try and get more protein. You ask people, "Well, you're so scared of this protein, not getting enough protein. Have you ever seen somebody who hasn't got enough protein? What does that look like?" They can't tell you, right? I have no idea but the people that we're talking about, right? We're not talking about people that are starving to death. But this idea of I'm not going to get enough protein, they're so scared of it, but nobody knows what it even looks like. Maybe that's why it's so scary. I don't know. But it's like, let's not be scared of something and then do something reactively that winds up actually hurting us when the initial concern wasn't actually a problem. So I think
Right.
that's particularly important to think about.
Well, it is funny, obviously, if there was a major epidemic of people deficient in protein, we'd probably know, most people probably know what it was called even, and they don't even know,
Right.
what it's called when someone's deficient. You know what it is when it's D or C, but nobody
Right,
knows.
right, protein, right. But everybody's I got to get more. I got to get more. They don't know how much they need. They don't know. But I know I need more. I know I need more. Right. It's this.
And where does that concept that we need so much protein, and not only that, but like that protein is the nutrient that is like the cure all and end all for for all nutrients, or is like the bedrock of nutrients? I'll ask that of any of you.
maybe the fitness industry. I mean, you know, I think it's pretty prevalent there, but
It's the idea that it's the
social
material
media.
that's to build things, I guess.
Yeah.
So Jennifer, so real quickly, what is the earliest sign? So you said most people don't even realize they have these issues.
Hmm.
What is the earliest sign that someone might look out for that they may have like an aha moment, like, huh, maybe something's not wrong? Like you mentioned the bubbles, is that the earliest thing that they would see, or?
That's the bad thing about kidney disease. And that's why I think that so many people end up on dialysis. The problem is people aren't being screened appropriately. And there are a lot of times there are no symptoms until you're very far gone. You don't, if even at a late stage 3, sometimes you're not going to see like edema in the legs. You're not going to see anything like that. And so I think a lot of times people just don't know. And then even when they do know, so usually it's like a primary care doctor or an endocrinologist or somebody that finds it, and then they refer to the nephrologist. But then the nephrologist never refers, not never, most nephrologists in the United States do not refer to a dietitian, never mention diet at all. And that should be the bedrock of their treatment. And so that's the problem. It's a silent disease. So you likely won't know, but if you until you're very late stage. And then at that point your GFRs, so in the kidney is made up of functional units called nephrons. Once a nephron dies, it never comes back. So like, the liver will regenerate. Nephrons don't regenerate. And so um the let's say if you have one that dies here, now all these others are working harder. And so then another one dies. Now all these others are working harder. So the quicker you can get a handle on that and let the kidneys rest. Um, the a lot of times, like in stage 3, I'll see there's something called glomerular filtration rate. That's how you tell what stage of disease you're in. I'll see that get better. It will go the other way. But if you're late stage, if you're stage 4 or 5, sometimes we're just holding steady. And either way, you know, fight for where you are, fight for that GFR. But if you can at least hold steady, that even is better because once you're on dialysis, the dialysis machine removes waste well, but there's certain molecules that are a little bit too big for it to remove. But if you do have some residual renal function, like your kidneys are still working a little bit, that's a good thing because they will remove those larger molecules. So the longer you can hang on to any kidney function that you have, the better.